Hello, I'm Alexandria Avila, and this is my presentation on speech-language impairments. So let's start off with what is an SLP. An SLP is a speech-language pathologist. So speech-language pathologist is a person that works with people of all ages, from babies to adults. SLPs treat many types of communication and swallowing problems. This was stated by Asha. So some examples is they treat fluency disorders, articulation disorders, as well as voice disorders and much more. Now, many of us think that speech and language is the same thing, but it is not. So what is the difference between speech and language? Well, speech is the production of sounds. There are 3 categories in speech: articulation, voice, and fluency. Next is language. Language is the comprehension of a spoken, written, or other symbol-based system, like receptive language and expressive language. Fluency. Let's look at a fluency disorder. So what is fluency? Fluency is the smoothness or rhythm in our speech. A most common fluency disorder is stuttering. Stuttering occurs when normal speech is disrupted by involuntary repetitions or prolongations of sounds, syllables, words or phrases, sound blocks, interjections, or revisions. This was stated in the article Childhood Stuttering and Fluency Disorders. So how can this service be delivered? So this can be done in a school or in a private practice, depending how severe the stuttering is or how severe the fluency disorder is. And for advocacy, we can look at educators, therapists, even the SLPs, parents, and family members. So what are speech language goals for this fluency disorder? So the child will be able to use a strategy learned in therapy and get at least 75% of words with little to no stuttering. Some areas of academics that can be affected. It can affect their confidence, their participation, as well as being social with others. Next is articulation disorder. What is articulation? It is the way we produce sounds when we move our lips, mouth, and tongue. So the service delivery models can be done in a school or in a private practice. The advocacy can be educators, therapists, SLPs, parents, family members, even doctors as well. Our speech language goals for an articulation disorder is we would want the patient to be able to produce sounds correctly, be able to communicate with others as well. The areas of academics that can be affected is it can affect reading and writing skills, also social interactions with peers. Voice disorder. What is voice? Voice deals with our vocal cords. Air is inhaled and exhaled by our lungs, so we are able to make phonation. An example of a voice disorder is laryngitis. Laryngitis is an inflammation of your voice box, also known as the larynx, from overuse, irritation, or infection. This was stated in the article Laryngitis. So some service delivery models can be done in a school, in a private practice, as well as a hospital. Advocacy can be the same: educators, therapists, SLPs, parents, family members, as well as doctors. And some speech language goals for a voice disorder can be they will be able to use a different way of communicating, and they will also be improving the ability to social interact with others. Areas of academics that can be affected is it can affect the speaking overall, since it is messing up those vocal cords. So on the right side, I do have a picture of how the vocal cords get inflamed, and also as well as how the healthy vocal cords look. So as you can see, that is how it affects the vocal cords. So when speaking, it may be difficult, and that is laryngitis. Language disorder. So there can be receptive language disorder and expressive language disorder. So with receptive language disorder, a child may have difficulty understanding the words or sentences used by others. And then with expressive language disorder, a child may have difficulty coming up with the right words when speaking. This was said in the article Language Disorder. So here's a continuation of language disorders. The service delivery models can be done in school, private practice, hospital, even a physician's office. Advocacy can be educators, therapists, SLPs, parents, family members, doctors. And now moving on to speech language goals. So they will be able to use a different way of communicating. They will also be able to improve the ability to social interact, and they will be able to use gestures to communicate as well. Areas of academics that can be affected. So it can affect the way they learn, it can affect their participation and their social skills. So now you may ask, where can I find an SLP? Well, you can find them in hospitals, schools, private practices, physicians' offices, and rehabilitation centers. Thank you for your time. I hope you enjoyed learning with me, and it was nice to meet everyone. Here are the references I used throughout the presentation.